Hello Internet, welcome to RecSport Education. I'm Ryan Shanahan, and today I'd like to talk to you about a little phenomenon I've recently become aware of. You see, there are many forms of medicine and health treatments that claim various benefits, and some of those benefits sound really good, at least at first, but after thinking about it for a while, you start to question what you're being told. So here is my list of top 5 red flag health benefits that are used incorrectly and that we should all stop saying. Number 1, it eliminates toxins. Alternative medicine and therapies such as massage therapy or cupping that list toxin elimination as one of its health benefits is a misnomer or a red flag. The language surrounding what toxins are is purposely vague, according to Gaia.com, but this has made the use of the word more of a throwaway term than anything about your health. While there really are substances that are toxic to your body, such as heavy metals, soft plastics, and certain chemicals and pesticides, a lot of us, including alternative medicine practitioners, forget that clean water and oxygen are also toxic if you take in too much of either too quickly. The idea that your body is storing a lot of toxins in the muscles, bone, and other tissues is simply wrong. Your body doesn't work that way. There are substances that are left over from natural metabolic activity, but they aren't toxic, and they get flushed out of your body and down the toilet naturally. Even lactic acid built up from your workout isn't toxic, and studies have shown that massage isn't great at removing it anyway, so the only problem you can have with toxins comes from what you take into your body through ingestion or through other external means, and most people just aren't exposed to those kinds of poisons. And if they are, it's usually not enough to cause a problem. In fact, you can be exposed to many kinds of substances without them affecting you, because it's often not the substance itself that is a problem, but the quantity of a substance that makes it toxic. Your body has an amazing filtration system. The liver and kidneys are constantly filtering out harmful substances from your body. This includes your own byproducts like dead skin cells, food, hormones, and other regulatory substances that your body doesn't need anymore. Yes, your own body waste can become toxic to you if the substances are allowed to build up in your system, but that only happens if there's a problem with your liver or kidneys. Otherwise, your body doesn't just store this stuff. The only other time it becomes a problem is when certain chemicals or heavy metals get into your system. These your body has a hard time filtering out. And in such case, there are medications and certain foods, like cilantro, which can help get those substances out. Therapeutic treatments, massage, and homeopathic medicine just isn't going to do it. Number 2, increases circulation. This is another misnomer. The idea that certain treatments and therapies have the effect of increasing circulation, and this is a healthy thing to do, is not only wrong, but can be considered irresponsible. Anything that is going to affect your circulation has to have an impact on your heart, the primary source of circulation in your body. Certain plants and other substances can have an effect on either lowering or increasing your circulation by way of vasoconstriction or vasodilation. And these often need to be monitored closely by a trained physician, because blood pressure is important to the staying alive thing we all like to do. If your blood pressure gets too low, you risk passing out and causing damage to organs and limbs. If it gets too high, you risk heart attack, stroke, or hemorrhaging. Because of this danger, your brain sends signals to your heart to keep it perfectly balanced. Increases in circulation happen whenever your brain feels there is a need to get more oxygen to the body than was previously needed. Like when you're about to stand up, sometimes the thought to stand and the action is too quick for your brain and heart to adjust to, and so you get dizzy and have to sit back down. There are other conditions that trigger changes in circulation, like the need to maintain a certain body temperature. And it's of course also triggered during a moment of exhilaration, fear, or adrenaline, because your heart is trying to prepare you to deal with a certain situation. But this is only temporary, and it's usually not a good idea to overtax those reflexive systems. Your heart wants to maintain a steady pulse, meaning sudden changes in circulation via external influences are not necessary or even a good idea most of the time. So therapies that report the health benefit of increasing circulation are mostly bogus and forget that that's not how your circulatory system works. You cannot localize circulation to a particular part of your body without affecting the rest of you. Most therapies have no ability to affect the circulatory system in any meaningful way, and in the cases where they do, it's usually because the treatment has triggered a temporary reflexive response, or the effect is chemically induced, in which case you should be careful about using it. Number 3. The reason this term is on the list might surprise you. Homeopathic medicine has been around a long time and has had a great impact on society and how we look at medicine, both for good and for bad. For instance, homeopathic principles were valuable during the 18th century, when traditional medicine was harsh and largely ineffective, using blistering, purging, and bloodletting for both everyday ailments and serious conditions. But according to the University of California, in an article published by Berkeley Wellness, October 2015, during the past 2 decades, various homeopathic remedies for conditions such as allergies, migraines, colds, and diarrhea have been tested in clinical trials. The better designed studies have found that the products work no better than a placebo. In contrast, studies that claim to find benefit tend to be flawed, poorly designed with a small number of subjects, no comparison group, and subjective outcomes. There have been no published controlled studies on homeopathic treatments for chronic diseases such as cancer, hypertension, or diabetes. Also recently, the Australian government's National Health and Medical Research Council undertook a comprehensive assessment of 176 controlled studies and 57 systemic reviews. It concluded there are no health conditions for which there is reliable evidence that homeopathy is effective. Even the National Center for Complementary and Integrative Health, part of the National Institute of Health, which generally supports alternative therapies, says there is little evidence to support homeopathy as an effective treatment for any specific condition, and that several key concepts of homeopathy are inconsistent with fundamental concepts of chemistry and physics. So while certain aspects of homeopathic principles can be useful to us to remember when looking for good treatments, the term homeopathy, used on labels and peddled to consumers to suggest a natural and more complete form of treatment over other proven forms, is just snake oil. Number 4. It betters digestion. Aiding digestion is a somewhat popular benefit to list on therapy charts. But why would you need to help your own automated digestive abilities in the first place? Well, it could be that you're on a prolonged dose of antibiotics and thus could use a regular source of probiotics to replace the microbes that aid in digestion in your gut. But even if that is the case, we should remember that taking probiotics isn't actually doing anything to affect your body's natural ability to digest food. Sometimes, alternative medicine practitioners confuse digestion with metabolism, or your metabolic rate, which refers generally to how fast your body consumes calories, and this is primarily affected by the type of diet you have and the type and volume of physical activity you engage in. In other words, you affect your digestive system by what you put into it and how you use the energy it provides. Health treatments, therapies, they do not. And finally, number 5, increases confidence. This has been an all too common reported health benefit for many types of medications, homeopathic remedies, and alternative therapies. But confidence remains the subjective reality of the individual, and there are many ways to interpret the confidence level of a person. Some take the position that lack of confidence is a chronic symptom of lifestyle, usually related to a person's diet or exercise level. Other times, systematic of a person's experiences, causing imbalances due to a person's outlook on the world. These practitioners prescribe many sorts of natural remedies, such as essential oils, herbs, and various supplements. Other practitioners, commercials from the pharmaceutical companies, for example, prefer to look at confidence level as an acute symptom, one that can be resolved by various medications designed to target something that the individual doesn't like about themselves. But whether or not these treatments actually affect the confidence level is a bit up in the air. The word is ambiguous. It's far too imprecise to gain a measure from. because everyone's confidence level is subjective to our own experience of the world. Incidentally, that's probably why it is used so often in commercials and by alternative medicine practitioners. It can mean any number of things, so the validity of the treatment adapts to the definition that best reflects your own experience. In other words, if you experience a version of confidence improvement, no matter how fleeting or mild it may be, then the treatment was successful, whether or not the experience was related to the treatment or some other entirely different variable. With this in mind, it's definitely a health term we all should see as a red flag and should stop using in medicine. Well, that's it for my list today. I hope you enjoyed it, and if you'd like to fight about it in the comments, please do so. I'd love to hear your takes on this, and if you know of any other health terms or benefits out there that seem a little fishy, why don't you tell me about those as well? Please like and subscribe and share it with a friend. If you'd like, I'd really appreciate you looking at our Patreon page and supporting us that way. It'll help me be able to produce more videos like this in the future. So until next time, stay healthy.